Okay, well, welcome to our presentation tonight. We're excited that you've taken the time to join us. Tonight's topic is required medical paperwork for athletic participation. Before I introduce the rest of our speakers or presenters tonight, I want to make sure you know that the athletic paperwork that we're going to focus on tonight is health-related, medically related paperwork. So as far as eligibility for grades or school choice or these types of things, that's for the athletics department. So with that said, I first would like to introduce Amber Harrell. Amber, tell us a little bit.
Hello, my name is Amber Harrell. I'm the athletic trainer at Ed White High School, Pride of the West Side. I've been here for 6 years now, enjoying the ride. Also, too, I have an event going on currently, so if I have to step away, that is why I'm leaving.
Okay, thank you, Amber. And Kevin?
Hi, I'm Kevin Rapps. I'm the athletic trainer at Baldwin Middle Senior High School. I've been here at Duval for 6 years as well. Yeah.
Living the dream as well.
Yeah, I don't want to say Pride of the West Side. I mean, we're a little bit more west, but yeah.
Right. Okay, very good. And I'm Jerry Stevens, also a licensed athletic trainer and the supervisor of district sports medicine. I've been an athletic trainer, a certified athletic trainer for almost 40 years now, and have been with the district for 3.5 years. So with that, we're going to get into our discussion, and I'm going to moderate this, but also talk a little bit about the history of these forms, where they come from, who the governing body is, and why our athletic trainers need this information and how important it is to ensure the safety of your children and the student athletes that participate in our high school athletic programs. So I'm going to attempt to share a few things with you. The first thing is that the forms that we're dealing with, the Florida High School Athletic Association is the governing body for the that's who governs the athletics as far as the rules for the sports in Duval County schools, our public schools. At the middle school level, they're all going to they're going to follow those same rules as far as paperwork. The same requirements are going to be at the middle school level because the middle school conference that governs that and through district athletics has followed those same rules. So it keeps it simple. Parents get introduced to these forms as early as 6th grade if their child participates in athletics, and then it will be consistent all the way through their senior year of high school. So one of the forms, I just wanted to show you something here. This is some of the things that also govern us are the state laws that affect athletic participation. This is the concussion law for the state of Florida that was signed in 2012. It's been in effect since July 1st of 2012 and has not changed. This sets the parameters as to who can clear athletes, who can disqualify a student athlete that's participating that's been suspected of receiving a head injury or concussion, and that whole process. So when we get into in a couple minutes the discussion of concussion and clearance and return to play, we will you'll know that this is where the foundation of that paperwork comes from, and why we follow things to the T, because it's required by state law. So other areas where we have things that are governed is in our school board policy, and in section 5.8, which is athletics and DCPS school board policy, it brings up these different things as well. So just to let you know that we don't just make this stuff out of thin air. We are following rules and regulations in Florida statute that's been in place for a number of years now. So if you ever had, if y'all, those of y'all that have joined, if you have questions, you can either put them in the chat, or at the end of the presentation, I believe your mics can be made live so that you can ask us directly. So we're going to touch on concussion right off the bat, since that's something that's in the front of mind with a lot of people with as far as their children's safety is concerned. And so we use an FHSAA form it's called the AT-18. I don't know why they came up with their numbers, but that's their classification of the form. It's the same form that's required throughout the state of Florida for all schools that are part of the Florida High School Athletic Association. And so it shouldn't be any different whether your children play in Duval County, if they play at a private school or public school, or in one of our area counties, anywhere in the state. If they sustain a concussion, this form is part of the return to play process. So Kevin, with all that information shared, I'm gonna bring that up. Can you see that okay for us? You're good?
Yes.
Okay. So Kevin, I've kind of skipped around here, but this is page 1, which is something that some parents may see and some may not. But what is the importance of having this filled out and giving it to the parents if you feel that their child has experienced a concussion?
The importance of this one is just because it gives us those symptoms and those things that child's exhibiting or reporting at the time of the incident. So sometimes those may go away or they may get worse or better, but this allows us to tell you, as well as the physician that you take your child to, what the symptoms and what we saw, so they can have the information to go off of based on the time of incident.
Great. And then there's some other good information on here as far as what, like kind of plan of care or what the parents can do and kind of answer some questions there. Yeah.
So those symptoms, the good above, but this is also a way to give you guys information on home care treatment. A lot of those things that some people, it's like, sleep is great. That's perfect for them. That's how they heal. But sometimes those misconceptions and those things of how to treat it at home. So this also gives you a good idea of what a home care for a concussion should be like.
Very good. And a question I've always gotten is, do like imaging, brain imaging, does that play a role in what we do?
I mean, it's always nice, but just like you can see on the sheet there, MRIs, CTs, they're great for those fractures, those kind of injuries like that. But as far as concussion, it's not something that shows up on those scans. So some people, if they've brought their child in and they get a CT scan, they say everything's fine. Sometimes they assume that means no concussion, no injury, nothing to worry about. So getting that information is helpful, but it doesn't necessarily mean that they're all clear.
Right. It's just a possible piece of the puzzle, as we're going to learn as we go through this part of the presentation. Thanks, Kevin. So Amber, I'm gonna pull up the first, which is the second page of the AT-18, if we're counting that one as the first page, and let you look at that a second and kind of explain what all's in this part of the return to play form.
Okay, so once that first page is sent home, letting the parents know the symptoms that the athlete was exhibiting that day, as well as that form needs to be taken to the doctor, because like Kevin said, sometimes those symptoms that you see initially, once they get to the doctor, those symptoms have gone away. So just it's good for a referral piece. So what happens here, this part of the AT18 form is they're at the doctor, and when they're at the doctor being evaluated, the doctor has to make sure they are asymptomatic, they're off of any medications related to this concussion if they were taking any. They have to make sure they have a normal neurological exam, and an important piece is that they return back to normal classroom activity. And then below, if any testing is available, that they return back to baseline, that they're good to go. And this piece is important because the athlete that has suffered a concussion has to see a doctor before they can come back to play. And once they come back to play, they can't just be thrown back in. We have a graded return to play protocol that they must follow. It consists of 5 steps, and each step takes at least 24 hours to complete. Now, you may have an athlete who maybe start exhibiting some of those symptoms while they're doing their graded return to play. So how we deal with that is if they are exhibiting those symptoms, they have to stop at the step that they're on, and they have to wait 24 hours or when they're asymptomatic again, and then they can resume once that happens. And then the supervising healthcare person would be the athletic trainer at the school that is making sure that they complete these steps.
Very good. So when we look at this page, because we've talked about this page, they're distinctly different pages and they have different response, or they're providing different stages of this recovery. So you as your student athlete has completed all of these. Am I safe to say that, well, it says it's 1, 2, 3, 4, there's 6 steps there. Does that mean in 6 days I'm good to go? Or is it more so that, like you had mentioned, you need to be symptom free from the previous stage before you can move? So you could get stuck on a stage for a day or two, couldn't you?
Yes.
Okay. And so, and having you as the licensed healthcare provider at the practice or at the field with that student athlete can give them that good consistency of the same person is monitoring their progress, right? And so the student athletes completed that, and then thanks, Amber. The physician has signed it, Kevin, and and you've signed it, and now you're sending this back to this page to the doctor. So Kevin, I'm going to let you chat about this page a little bit.
Yeah.
Thanks,
so
Amber.
This is Jared, can you go up a little bit to the bottom of the
you see that
previous page?
Oh,
because right there, just where it says physician reviewed. So right there is what tells us that we did those steps with the athlete. We filled it out, and then the physician has reviewed that, which will allow us and them. And then can you go to the second page again, or go down? Yeah. So then that will allow us to get this return to activity. The thing with this is we have to have it. So it's one of those where we can't take anyone's word for it. It has to be completed, filled out, and then in our hands before we can let anyone on the field. So it sometimes leads to some headaches, but it's easier to leave no wiggle room and just make it black and white for everybody than to try and work anything else. So this is the main thing we need completed by the physician.
very good. And it's this little bit at the bottom here. This form is not valid until all fields are completed. That is going to be consistent with any form we review tonight during this presentation. And so you guys did a great job on that. I'm gonna wrap that up as we shift to some other forms here. But the law says this is the medical doctor, an MD, or a doctor of osteopathic medicine are the only two healthcare providers that can clear a student athlete from a concussion to return to full activity. And as Kevin just said, you know, it's nice. Parents will come, they're all excited and say, the doctor said. Well, that's great what the doctor said, but until we get this piece of paper, we can't clear, because that's not under our ability to practice. We can't extend that authority. So we're going to be expecting this form in our hands prior to, you know, being able to allow your child back in play. The other point with concussions is once a student athlete is pulled from a game or practice session with the suspected concussion and is evaluated by the athletic trainer, all of this whole process is now triggered into motion and needs to be completed before we can clear them. That's the way the law reads, and that's how we have to function. At times we get frustrated parents, we get frustrated coaches, and we get frustrated ourselves, but this is the rules that we have to follow. So keep your questions in mind, and we will come back to those. So now we're going to switch off. Kevin, I'm going to stick with you for a moment, and we're going to go to the physical form, which we call the PPE, or the pre-participation examination. And as I pull this up, make sure I've got that's it there. A couple of things I want to point out here. This is still, it will probably be finalized, okay, as far as put into use and access for parents and student athletes going forward on Monday, when the FHSAA Executive Board puts their final stamp of approval on that. They've just made some recent updates to these forms and the process of how these forms are managed. So what we're going to focus on tonight is what's important, what you as a parent can do to make sure this is filled out properly. And again, if it's not filled out completely, it's not valid. So I want to stress that going forward. So Kevin, so what's the importance of a properly completed EL2 form, a physical form?
One, it tells us that your child is healthy and able to participate. But a lot of it gives us information that is important with their health or pre-existing conditions, or even at the very least the history form, because that's also emergency contact information. So not filling out the top and not having those things are also things that can make it difficult, especially when you need to be contacted or reached due to one of these things. But a lot of the importance of it is we need to know in case something happens. If they have an allergy, if they have asthma, those are things that we, especially the athletic trainers, but the schools as well, is to be prepared for, because we don't want to find out in the moment that, hey, I have asthma and I don't have my inhaler. So these things for us are really important, because we review them and we come up with plans, or we point out kids that might have potential injuries or things going forward. So answering those questions and not just letting your kids just go down and taking them serious is really helpful for us in the event of an emergency or something like that.
Right, exactly. So, and then on this page, you see this information here at the bottom. student athlete's name, signatures, all of that. So again, that small writing right there, talks about things that are required by its state law in order for your child to participate. And again, right here, this form is not considered valid unless all sections are complete. So it really helps your physician and especially your school's athletic trainer to know these things so he or she can be prepared. As Kevin just mentioned, if there's something with an asthma or diabetes or sickle cell trait, some specific things like that are important to know ahead of time. So good job, Kevin. Well, Amber, this is a new form. They've made some changes on this form. And so we have this page 4 now that is what, so to explain to the people in the audience, your child goes to the doctor, gets this screening, and one of two things is going to happen. One is, the doctor's completed the assessment of your child and has cleared them to participate in activity. You as the parent are going to keep all the stuff that Kevin just spoke about. That's your son or daughter's medical record, and it's your responsibility to you're the custodian of that medical information. So from that point, what's going to be given to the coach or to the athletic trainer at the school will be the medical eligibility form that you're looking at right now. And again, it has the important information on it as far as contact information, and as current information there as possible is important. And if anything changes throughout your child's term with the school, that year, update it. Make sure that so that we can make sure we get a hold of you in that emergency. So Amber, I want you to talk about this sheet because this is what's going to be probably in many cases brought to the school, and what's important for you as an athletic trainer to have on there.
Okay. So like Kevin was saying, that top piece right there that has the student's information is very important for an emergency contact. You also see the different options. I'm sorry, it's really small, so I'm doing.
I can make it bigger for you.
Okay. And like Jerry said, like this is a new form, so oh yeah, that's good. So they have options. The doctors have options to choose from. We're looking at the medically eligible for all sports without restriction. That's what we're hoping for. But in any case where your athlete is not medically eligible for any sport, they have that option. But we're also looking for that, like you said, that information that previously we were getting, we will no longer be getting, but they have an area for the doctor to mark, for the doctor or the parent to mark off what pre-existing conditions we're looking at, or if any previous injuries that may affect the child while they're participating in sports. I also want to say that this form is only good for a calendar year. So your athlete has to do this form every year that they're participating in sports.
Exactly. And I don't, one of the things that we've learned in our preparation for this, good job, Amber, is that if a child is within the state of Florida and transfers from school district to school district or school to school, it's important that this information goes with them. Okay, so that way it follows them, and you as a parent need to take that responsibility and make sure that happens. And the other thing is if your child has come here from out of state and they had a physical in August and now they're here in Florida, they have to get this form completed. The states don't have any what we call reciprocity between screening forms. Even though they are very similar, we have to have an FHSAA EL2 completed. And so again, it requires that the child have another physician visit here locally to get that taken care of. So Amber, while I've got you on the line, the next the next form is this consent form. You need me to make that a little larger for you as well?
Yes, just a little bit.
Okay. Thank
you.
And just as a preface or introduction, so this is the consent and release from liability. It's 4 pages. We're focusing just on this page here. And Amber, that little highlighted or grayed area, explain why that's so important.
It's important for me because it gives me authorization to help your child if in the event that they have an injury or an emergency happen at the school, that I'm able to provide healthcare services to them. So that's why this part of the EL3 is very important to me.
Exactly. So without that, you know, Amber, Kevin, any of their 15 more athletic trainers that we have at our schools in the school district, it allows them to act and assess and evaluate that injury, communicate what they find with you, and able to treat that as well. So, and that's a very important piece, because we don't want to delay care if it's something that needs to take place on that. So I don't have any, we're going to discuss a couple of other things here that I don't have any shares for. So I'm going to get rid of the share aspect of it here. And we're just going to kind of discuss the remaining part. So I think, Kevin, both you and Amber mentioned this in passing, but I want to kind of drill down on it. So Kevin, so we've talked concussion, we've talked physicals. What if it's an ankle sprain or a knee sprain or a shoulder dislocation? What information do you need to see? Can the parent just call and say, my son or daughter's fine, they can play? What do you need to see at this point?
Yeah, so one of the most important things for our position is we're part of a ladder. So we work underneath a physician. So whether that physician is a dermatologist, orthopedic, they're up on the ladder than us. So when they give us information, if they say, hey, 4 weeks or 6 weeks, no participation, whether I think they could be back in a week or you think we're locked in on, that's what the physician says. So a lot of times you may have different opinions with something, but just like everything else we do, we have to abide by that physician. So with things like that, that's the importance of the note. If you go and see a physician, a doctor, that note is what tells us, okay, this is their plan of action that we're following. So yeah, a lot of those, they said, the doctor said it's fine, or they said we need the paper because it's what allows us to work. So that's the importance of those, of bringing those things back to us, and so the school has it.
Excellent. So that prescription, that piece of paper that has Dr. Jones's name on there and the physician practice and dated, that's what you're looking for, correct?
Yes.
So Amber, what about those kids that, what do you operate under? Hopefully you'll know where I'm going with the standing order, but you operate, so you have, you're working a game, you're staffing a game, a student athlete comes out with a complaint of something, you assess that student athlete, you tape them up, and they go back in and play. What piece of paper did we have there? What is it that allows you to make those decisions on a daily basis where, you know, it doesn't appear that there's a doctor involved, but behind the scenes there really is?
Are you talking about the communication that I have with my team doctor?
Right, and the thing that you get signed every year by your team doctor.
Oh, my SOP.
Yes.
So basically, it's a piece of paper outlining the procedures that need to happen for injuries, what I'm okay to do, and what I'm okay not to do, and what we need to discuss. And when I say we, I'm talking about me and my team physician. Each school has one just like an athletic trainer, so it's a very unique relationship.
Exactly. And so just in closing, before we open up for questions, so I'm going to kind of close the loop here with the fact that all of us as athletic trainers licensed in the state of Florida, we're governed by the Florida Board of Athletic Training, which I'm a member. I'm a sitting member of that board. And we're under the Florida Department of Health Medical Quality Assurance. State law, our State Practice Act, requires that we have this contract, this agreement, this standing order agreement with our team physician. And so, again, that's for your safety, your child's safety, the community's safety, but it also puts restrictions and defines what processes we can do. So we are limited by that. And that's going to vary a little bit between that relationship with the team physician at Ed White versus the team physician at Baldwin or any one of our schools based on that relationship. So even though that physician athletic trainer relationship is maybe outside of you taking your children to see your family practice doctor or going to CareSpot or going to the emergency room, our athletic trainers can work under that SOP as well, which is what Kevin was talking about with the piece of paper. So we have that one, but if there's a concern about things, with that, as Kevin, as you said, if this doctor says it's 4 weeks till they can return to play, then you and your team physician really can't change that. Doctors are going against doctors, and we're not we're not going to play in that game. We're not going to play in that sandbox. So, and one of the things that's to close is the athletic trainers. Again, we're licensed healthcare providers. We've completed education from an accredited university. These two younger generation athletic trainers both have their masters. I'm a much older school person and do not, but we all have a lot of continuing education and a lot of experience in the area where we work. We have a national board certification that we have that then we can allows us to get our Florida license that we have to maintain going forward. So I want to thank both of you for joining me tonight with this presentation. I hope there are some questions out there. If not, that's fine too. And that's the end of our presentation for this evening.